Hello, everybody. Thank you so much for joining me. I'm Janie Goddard, President of the Complementary Medical Association. And in today's CMA showcase video, I am joined by none other than CMA fellow Michael Moxon. Michael, thank you so much for joining us.
Speaking.
So, Michael, thank you. Would you like to start off by introducing yourself and giving us a little bit of background as to how did you get into the work that you do? And tell us a little bit about that work, if you don't mind.
Yeah, sure. My name is Michael Moxon. I've been doing this for many years now. I started my career as a carpenter, but I have a condition called Ehlers-Danlos. So my joints are hypermobile. I have connective tissue issues. I heal slowly, and my joints, I have pain in my joints, and also a lot of back problems. So I've a lot of chiropractors, osteopaths, Harley Street doctors, Harley Street acupuncturists. I spent a lot of money trying to help and assist my condition, which at times was excruciating. I first collapsed and was taken to hospital at the age of 19. I'm 67 this year, by the way. So I was 19 years of age, and they carried me in the hospital, and I was diagnosed with an old man's disease of wearing away of the vertebra. Well, that was shock horror. My parents, my family, goodness me, you're only 19, Michael, etc. And so basically, I left the building industry because of my condition. I kept having serious back issues to the extent I prolapsed my L5-S1, and I was crippled. It was such a bad injury that I wanted to operate, and they said if I didn't have surgery, they wanted to replace the disc on my L5-S1, and they said if I didn't have surgery, I'd be wheelchair bound within 18 months because of my Ehlers-Danlos, etc. Right. Well, I said no, thank you. I'll leave it to God, our divine creator, because I'm very, very spiritual. I'm not religious, I'm very, very spiritual, because everything comes from a light source. He's given me the gift that I have, and he's carried me through some very, very dark times through my life, to the point I nearly committed suicide 3 times with my injury, because I couldn't work. It was awful. But anyway, that was many years ago. I was very lucky to meet a chap who was trained by his father, old school osteopathy, right? So it was the old techniques, right? Yeah. And he aligned my spine. And it was the moment, it was, oh my goodness me, I've never had work done on me like this, right? He also had a genetic condition where he didn't have, he had a vertebra missing out of his lower lumbar because of, I can't remember his condition, but it was something like thalidomide, but it wasn't. But anyway, so his father took up osteopathy so he could look after his son, and he trained his son. And in turn, he then said to me, Michael, can you manipulate me? And this is going back over 30 years, right? And I said, well, I'll have a go. Anyway, I did it first time. Obviously, not fluently, but I did it first time. And he said to me, he called me Mick. He said to me, Mick, you've got to take this up. I said, what are you talking about? Right, you know, I like the builder. He said, Mick, you've got to take this up. You have a natural gift at manipulation. So I said, no. So it was for years I didn't. And I just used to manipulate people just to get them out of pain, do their necks, etc., etc. And in the end, the reason why I studied and did it professionally is because I realised that I can do the job properly, as I say. And I don't mean to run other practitioners down, but my treatment is intense and it works. And I've saved people from, not egotistically, I've saved people from spinal surgery, got them out of wheelchairs, etc., etc. And so this is why I took this profession up. And obviously through studying, etc., meeting more people globally, because I'm linked up globally with people. I also came across the Iteria Care frequency scale. I don't know if you heard of that. Have you heard of that?
Yes, I have. Yes, absolutely. Yeah.
Well, we are sponsors and distributors, and since using that in my treatments, where I used to say to patients, it's between 3 to 6 treatments, 4 to 8 if it's herniated or prolapsed disc, etc. Over 90%, we are getting them standing pain-free with one treatment. Over 90%. That is scalar frequency. It is absolutely mind-blowing. Mind-blowing healing. The only contraindications you get, you can't blow over the metal, as you know, but you get detoxification issues, right, when you first start using it. So that was literally a godsend. So now most of my patients now, even with prolapse and herniated discs, we're getting them done with one treatment.
That's absolutely extraordinary, Michael. And can you say a little bit about, for the viewers, for people who are not familiar with what scalar is, can you explain a little bit about sort of how it works? So if somebody comes along to see you, what actually do you do with them? I think that would be really helpful for people to know.
Sure. What you do, we take my wife. We work together. My wife and myself, we work together. So you have to take your top off, okay? Lay on the couch, and it's like a hairdryer, believe it or not. You blow along the spine, okay, and the back to relax and relax all the muscles and reduce inflammation, okay. For heavy duty, when I say heavy duty, when they come in on their hands and knees or Zimmer frames or wheelchairs, etc., what we do, I open the chakras. So I'll do the palms, the crown chakra, okay. Then we blow the back, yeah. But the reason why it's only taking one treatment, Janie, is because the reduction, the inflammation reduction is astronomical. It's just, I've never experienced anything like it. So we can gently align the vertebrae without having to have multiple treatments or several treatments, right? You can do it all in one because you just reduce the inflammation and relax the muscles. So the bones, they go in so easily. And it is a fabulous treatment. And we sell them, as people do globally. Then the results, the testimonials are just, they're off the scale. Yeah. So, yes. And then after that, I massage the mat with their clothes on. I massage, and I use shiatsu, but I've developed my own massage technique over the years. Love it. They just say, Michael, your hands, I said, well, it comes from light source. But anyway, that is for me to find out what is going along the cervical, thoracic, and lumbar, the spine, the back. So how did I know how I'm going to manipulate them? Because it has to be done clinically and in a certain, as I've learned from my own physical, you can't just do set pattern manipulation. It doesn't work. You don't get the 100% result. Yeah, it has to. You have to. It's like unpicking, and you have to put it back together in sequence in order of that person's physiology. We all have a spine, but we're all different, and we respond different to treatments. And it's just knowing how to put one bone, to set one bone to get another vertebra back. It's mind blowing. It really is.
Absolutely. The thing is, I mean, obviously, we know the work that you do, and the fact that you've been with the CMA for a really long time now, which obviously we're very, very proud to have you, and we do know that you are doing absolutely exceptional work. But I think it would be really helpful for the people watching, because obviously we know that back pain is one of the leading causes of absenteeism at work and so on. I'm struggling with sciatica at the moment, so I can speak to that and say, gosh, it really is debilitating. And so I know that so many people watching will just be so relating to what you're saying, and really probably very, very keen to find out how they can come and have treatments with you. So how do people find you? And are there any particular types of people, or people suffering with back pain that you will take, and are there any people that you can't take? So first of all, how do people find, and then are there any limitations to what you do?
Oh, yes, sure. I have a website. I don't advertise. I used to do a lot of social media. I do videos because I like to show people what they're paying for, what they're getting, how passionate I am about working with people. Janie, it's a privilege and an honor to be of service to humankind. Anyway, humanity. They find me basically on my website. But as I said, I'm very spiritual. I don't advertise, and I believe, and people come to me through our divine creator. This is just very, very spiritual. I use a lot of energy, spiritual energy, right? This is where my first and foremost, that's where I'm at, right, with the spiritual energy. But also, it's not, oh, come and see me once a month for a spinal adjustment. No. It's, we get the job done, maximum 2 treatments at the moment with the scalar frequency we're using. I educate my patients on back management, the do's, the don'ts, the bed, the mattress, the pillows, in and out of low cars, etc. Nutrition, I'm really big on nutrition, anti-inflammatory, etc. Foods, but it's the whole thing, the holistic. You have to take lifestyles of the people, their beds, no sleeping on the sofa to one side with the cushion because of the neck. It's no, there's so much. It's unlimited. The advice that I give them. Yeah, and also, Jay, if they can't make it to me, I'm speaking to people in Canada. I'm giving them advice. I'm speaking to people in America. Yeah, just over the phone, and they say no charge. There's no fee. I'm not materialistic. This is all, as I said, God, our divine creator of all creation. It's his work. And the people that come and see me, they just call me, email me, and I'll get in touch with them. And that's basically how it goes. Yeah.
That's fantastic. That really is. It's such a beautifully humane way of working, and I'm sure that everybody that you work with really appreciates, everything that you do for them. Because the thing is, if you can get people out of pain, it's an absolute gift, isn't it? And I love, Michael, I love what you're talking about, the way you work so holistically. So, the way you're working, not just, sort of cracking backs, but, it's a completely holistic way of working, isn't it? Which is so fantastic. I mean, it's certainly after my own heart, because that's the way that I work with my patients as well. So yeah, I totally get where you're coming from. Extraordinary. And thank you for the service that you do. It's remarkable.
Yeah, well, thank you, Jane. Thank you for the CMA. It's I don't want to embarrass or big you up, but it's amazing. I love to see you, Janie. You're off the scale. You are all at the CMA, and well, I've been with you many years.
You have, Michael. Yeah, you have. Yeah, you're such a, you've been with us a long time, and we do know about the work you do, and we work very hard. We know that you do, and it's a beautiful thing to have, to be able to have you with us, and to be able to sort of point, signpost people in your direction, because you're getting people out of absolutely debilitating, excruciating pain, and that is. It's marvelous. I'm not going to use the word miraculous, but but having said that, sometimes within our field we do have to look at some of the changes that we make and say, gosh, it is close to miraculous. So so thank you for everything you do. It's so we are so honoured to have you with us.
Yeah, thank you so much, Janie, for those kind words. But it's a privilege and an honour to be of service to and for humanity. And there's no greater, I say to my patients, my children, my family, friends, there's no greater feeling when you make a positive difference to somebody's life. Yeah, you feel 10 feet tall. It is just, especially when you can do it for no reward as well. That's the one, yeah, which we have done over the years. We have done. It's brilliant. Yeah.
Oh, Michael, honestly, it's been such a pleasure to chat with you today. At some point, we would really love to have you back in order to actually delve into the work that you do a bit more deeply. But obviously, we know, these little videos that we're doing as CMA showcase videos, we keep them short and sweet so that people can actually learn a little bit about you. And then obviously they can come to your website and find out a bit more. And I think if they're destined to find you, they'll find you. But for those of you who want a bit more information, Michael's website is in the show notes under this video, so you'll be able to find him very easily. But Michael, we'll love you and leave you there. And as I say, want to keep this, very, very easy for people to kind of view and all the rest of it. But we would really dearly love to have you back to perhaps maybe do a little bit of a tutorial on the way that you work and go a little bit deeper into it. How does that sound to you?
Absolutely fabulous. Well, thank you so much, Janie. Thank you so much.
It's such a pleasure. No, thank you for joining us today, Michael, and we'll see you very, very soon again. All the best.
All the best. Thank you. Bye.